Hello, and welcome to the Lakeridge Health 2021 Annual General Meeting. Please note that today's meeting is being recorded. Before we begin, we will take a moment to review the virtual meeting platform and how to use it. As you can see, this virtual meeting platform is a split screen. On the right-hand side of your screen is the Zoom meeting, where you will be able to see the presentation, watch the videos, and listen to the chair and other speakers. If you would like to turn the closed captions off, please select the Live Transcript button from the bottom of the Zoom panel, and then select Hide Subtitles. To make this Zoom panel full screen, click on the white square icon located in the top right-hand side of your screen. This will make the Zoom panel take up your entire screen and will make it easier to read small text on the screen. When a vote is opened, it will automatically minimize the Zoom panel back to only half of the screen so that you can cast your vote. There is also a second full screen icon that looks like two arrows pointing away from each other. Please do not use this arrow full screen icon. You will not be able to see the vote if you use this arrow full screen icon. If you accidentally do use this arrow icon and your Zoom is covering up all controls on your screen, or if you cannot see the vote on the left-hand side of your screen, please do press the Escape key, ESC, on your keyboard to minimize the Zoom panel and return to the split screen view again. Now let's talk about the left-hand side of your screen. On the left-hand side of your screen is where you will see the information page with instructions on how to use this platform. There is also a Documents module. It looks like a piece of paper in the top menu bar. This will have resource documents and instructions on how to use this virtual meeting platform. The left-hand side of your screen is also where the vote will appear. It will automatically pop up on the left side for eligible voting members. Guests will not see the vote. To cast your vote, simply click on your selection and it will be highlighted. You will see confirmation text of your vote on the screen as well. There is no submit button. To change your vote, simply click on a new selection and you will see it also highlighted. You can change your vote up until the chair closes the vote. Then the vote will disappear from your screen. Now let's practice a vote to ensure our voting function is working properly. We invite our corporate members to try a test vote based on the following question. Are you able to hear the audio on your device adequately? You should now see this vote open on the left-hand side of your screen. Voting will be open for 30 seconds. Please do cast your vote now. Five more seconds to cast your vote. Voting is now closed. Let's please see the results. Great, thank you. The voting function is working properly. It is now my pleasure to turn tonight's meeting over to Sharon Cochran, Chair of the Board of Trustees for Lakeridge Health. The floor is now yours.
Thank you. Good evening to everyone. My name is Sharon Cochran, and I am the Chair of the Board of Trustees for Lakeridge Health. And I would like to welcome you to our 2020-21 Annual General Meeting. We're very pleased that you have joined us this evening as we reflect on our accomplishments over this past year but more importantly, that we also recognize the people behind these accomplishments. You also will have a chance to hear about the year ahead plans, and you also hear about our quality plans. And then later in the hour, our formal corporate members will be voting on priority business items. You will note that we have a slide on Bowmanville up. And our intention this year was to hold this year's AGM in beautiful Bowmanville. But similar to last year, the pandemic restrictions are preventing us from meeting in person. But it has been a very exciting year for Bowmanville as a hospital redevelopment moved to the next planning phase. And we are very grateful for the financial commitments from the Ontario government, from the region of Durham, and for the fundraising efforts by the Bowmanville Foundation and the auxiliary. This funding will support the expansion of the hospital's infrastructure, larger emergency department, increased inpatient unit beds, and an updated diagnostic imaging services. All this will enable better and more accessible care for the Bowmanville community for many years to come. I also would like to say in my introduction, and that is to thank my fellow board members for their tremendous commitment over this past year. And for, I think back to all of the time and the energy that all of you committed on many of our activities. And also for your support to me as a board chair. So just a huge to my colleagues. I also would like to recognize the members of the Durham's municipal and provincial government who have joined our meeting tonight. We have John Henry, the regional chair and CEO. Thank you, John, for joining. Dave Ryan, the mayor of City of Pickering. And thank you, Dave. And we have Rod Phillips, the MPP for Ajax. Thank you, Rod. Thank you to all three of you. We respectfully acknowledge that we are gathered on the land and the traditional territory of the Mississaugas of Scugog Island First Nation, a branch of the Greater Anishinaabe Nation that includes the Ojibwe, Ottawa, and Potawatomi. We gather with gratitude and thank the Mississaugas and other Indigenous peoples for caring for this land and for sharing the land under the Williams Treaty 20 with those of us who are newcomers. We are called to treat the land, its plants, animals, stories, and its peoples with honor and respect. Please welcome Kathy McLeod Beaver, the Indigenous Navigator for the Central East Regional Cancer Program, to lead the traditional smudging ceremony. Kathy.
Bonjour, Samakwe Indigenous, Makwa Dodem, Alderville First Nation Dunjaba. In the Ojibwe language, I said my spirit name is Tobacco Woman, and I am from the Bear Clan. The smudge ceremony is cleansing and purification ceremony. This ceremony brings peace and clarity and protection in times of stress. The four sacred medicines are cedar, tobacco, sage, and sweetgrass. Everything in creation has a spirit, including us, the plants, the animals, the waters, the rocks, including Mother Earth. Each medicine has its own teachings, but today I wish to highlight the meaning of sacred tobacco, not the commercial tobacco used in cigarettes. Tobacco is a medicine and an offering. The teaching is that it's that medicine that goes first before everything else. Whatever we take from Mother Earth, it is said that the tobacco goes first. It is about respect and relationship with all living things. It is said that when you pick the medicine from the land, the medicine is giving its life so that you can have life. When we pray, we offer tobacco. It is a spiritual exchange between you and the Creator. Before we smudge today, I will offer tobacco to ask for guidance for all of us as we come together. I will now light the smudge. We take the smudge, the smoke of this medicine with our hands, and we draw it over us. We are asking this medicine to help guide us in a good way, meaning that we are asking this medicine to help us see, hear, and speak and feel in a good way. As we do this ceremony together, I invite you to speak from your mind to this medicine for what it is that you are looking for. It helps us to let go of things in times that in life that is not ours to carry. It has been a difficult year, but tonight I would like to celebrate and honor our resiliency and continued commitment to caring and sharing together. Ahau miigwach, ni kanigana, acknowledging gratitude to the universe.
Yes, Kathy, and thank you very much. Our past year, as we reflect on this past year, our thoughts dominated by the COVID-19 pandemic. We acknowledge the personal impact the pandemic has had on so many and the sacrifices made to keep our community safe. Thank you to everyone. Lakeridge Health has been on the front lines of the healthcare crisis. Over 3 consecutive waves, high quality and compassionate care has been consistently delivered. I would like to extend our sincere thanks and appreciation to all the Lakeridge Health teams who have protected our community like never before. In addition to our COVID response, this year has been filled with a number of extraordinary accomplishments for Lakeridge Health, and I would like to just highlight a few of those. One is that after many months of planning, we completed the voluntary integration with the Durham Mental Health Services. Are now working together to enable better coordination and faster access to mental health and addiction services. Another accomplishment, we started construction on the long-term care home located next to the Ajax Pickering Hospital. This is one of 3 high-profile accelerated projects directed by the province. And this will add 320 long-term care beds in Durham by, and I'm going to emphasize this, by early 2022. Another accomplishment. The Central East Regional Cancer Program finished this year #1 in the province. and I'm going to repeat that, #1 in the province as it relates to key quality indicators. And I do believe this is a testament to the efforts to improve access to high quality cancer care across our entire region. And this year, we accelerated our work to support inclusion, diversity, equity, and accessibility. And it has been a very particularly trying year with so many alarming events around the world and here in Canada. The murder of George Floyd, the remains of Indigenous children found in British Columbia, and most recently, the tragic hate crime against a Muslim family in London. These are all examples of the work ahead to truly become an equitable and a just society. Each tragedy strengthens our resolve to take a stand against intolerance and to do our part to foster inclusive environment, enhance the well-being of our people, our patients, and our community. And finally, they say a picture is worth 1,000 words. So I am very pleased to share a short year in review video that summarizes some of these highlights. Thank you.
It's been a long road to recovery for Herb Knapp, who's somehow picked up COVID-19 in the community. One that's become a success story. Everybody is celebrating.
As you can see from this wonderful video, it has been a monumental year for Lakeridge Health. I would like to thank all our community and provincial partners, our community advisory panels, patient and family experience advisors, our many volunteers, our foundations and auxiliaries. All of you have come together with a shared desire for a healthier community. Just a huge thank you for your continued support. I'm now delighted to introduce our new president and CEO, Cynthia Davis, to share her perspective on the year ahead. Cynthia.
Thank you, Sharon, and hello, everyone. I'm absolutely thrilled to be attending my first Lakeridge Health AGM. It's been a wonderful 6 months for me since I've joined Lakeridge Health, and I've appreciated the warm welcome that all of you have given me. Joining an organization during a pandemic has been a unique experience. I've gotten to know our team and our community very quickly. This year has tested us in so many ways, particularly our emergency departments, our COVID units, and our critical care units. And beyond the walls of our own hospital, we've extended our care to help with long-term care homes, and we've operationalized COVID testing and vaccines throughout the Durham region. The caliber of the Lakeridge Health team is second to none. They rose to the challenge every day, united by a shared commitment to do whatever they could for the people entrusted in our care. They are true healthcare heroes, and I thank each and every one of them. We couldn't have done this alone. Our organization was so fortunate to be surrounded by strong community partners, and I'm so proud of what we've accomplished together. I know many of you are joining us tonight, and I want to say a huge thank you. So now, as the pandemic shows signs of slowing down, we're working to resume surgery and services, and at the same time, we will remain diligent to respond to any events related to COVID surges. We are also carefully unpacking what this past year has taught us, and that we move forward stronger and smarter as an organization post-COVID. I believe our vision, one system, best health, is the ideal platform for us to build our future. Our vision compels us to think beyond the traditional roles and structures, to think and act as one system, supporting the broader needs of our community across the healthcare continuum. And at the center of everything we do is an unwavering commitment to quality and safety. And with that, putting patients and their families first for all we do. We know that healthcare does not start and stop at the doors of our hospitals. Many factors impact the health of our community, particularly for the vulnerable and the underserved populations. One of the biggest priorities for me will be to increase the collaboration with our community and regional partners. So we will work together to break down the barriers of access for the diverse populations which we serve. And we're already making lots of progress in this area through our collaborative Ontario health teams, the evolution of our mental health and addictions programs, and the work that we're doing with community and home supports to find better solutions for patients in our hospitals who no longer require acute care. This year, we'll also take important steps towards our master plan to identify a future site for a new hospital to serve the entire region through an independent selection process. And we'll also continue to expand our footprint and modernize our facilities, the Bowmanville expansion, the long-term care accelerated build, and the innovative Jerry Coughlin Health and Wellness Center. All unique opportunities for us to address the growing and changing needs of our community in the Durham region. We will also continue to deliver financially sound and sustainable health that ensures the highest value without a compromise to the quality of care we deliver. And finally, we will invest in our people, many of whom you've seen tonight, and tremendous stories. Through our training and mentorship programs designed for the leaders in our organization, we will inspire our teams to provide care with both innovation and joy. I'm so delighted for the opportunities that are in front of us. And I look forward to working with all of you as we continue to build healthy and vibrant communities throughout the Durham region. And now I'm really pleased to share a story from our past, a story of hope and courage, one from Craig Wilson, a Lakeridge Health patient and a COVID survivor.
When that journey started, we went to say goodbye to him because he wasn't supposed to make it. If there was going to be a funeral, I had already written what I was going to say. And 120 days later, he made it.
Yeah.
Oh, I've been waiting for this day.
I was so happy to just be home. It had been so long, although I don't remember a lot of it.
Well, he ended up with pneumonia, COVID-related pneumonia, and he ended up in the ICU at Ajax Pickering and intubated, and then they had to send him to Oshawa because at that point his kidneys failed and he needed dialysis. So they moved him to there, and the doctor in the ICU said, "You better come say goodbye because he's not going to make it."
I felt bad that, she had to go through that. It's something that no one should have to do for their loved ones.
Thankfully the medical staff didn't give up on him. They worked on him. They, we're so grateful for that, what they've done for him.
The home hemodialysis is basically what you are having in center now, but doing it at home.
Then he went to Whitby, Lakeridge Whitby, where he finished off there with the rehab and dialysis, and he still goes there for dialysis now. May 7th, when he came home, was actually the day of our first date 49 years ago. That made it even a little more special that he was coming home.
Every day is just a blessing. I have, another day, and hopefully a lot more days to come.
So that's such a wonderful, inspiring story, and it reminds all of us why we are here and why we do the work that we do. And I want to extend my sincere appreciation to Craig and Paulette for allowing us to share their story with you today. Now I'm going to turn things over to my partner on this journey, Dr. Tony Stone, Chief of Staff for Lakeridge Health.
Did it again. I was on mute. So thank you very much, Cindy. And hello, everyone. It's great to be here with you. I'm very happy to be here tonight and to pause and reflect with you on the year that has passed and the year ahead. To say that last year was a challenge is an understatement. Never have we seen our hospital system and our people stretched in so many ways. The accomplishments of our staff and physicians have been nothing short of remarkable. As you know, Lakeridge Health's focus is to provide the highest quality of care and the best outcomes for our patients. This evening, I'd like to highlight two exciting examples of how technology is helping us enable and accelerate our quality agenda. This pandemic forced us to make care accessible outside the hospital environment by harnessing virtual technology to bring services into people's homes and enable communication between physicians and patients. We created these wonderful virtual wards that have really helped deliver care in home safely. And today we're providing this remote support to hundreds of patients every month for a variety of needs: critical care assessments, mental health support, dialysis and rehab services, and cancer care consultation and follow-up. Moving forward, virtual care will become a standard practice in more clinical areas as we better understand its role in our overall healthcare system and value from a quality and accessibility standpoint. My next example will be a real game changer for us and for our patients. This year, Lakeridge Health and 6 other hospital organizations across the Central East region will introduce EPIC, a world-class clinical information system. EPIC will enable a regional central intake and referral system. All 14 hospitals who are participating will have access to the same patient record, and this will reduce duplication and will let us streamline processes. This will mean more time at the bedside, improved quality and safety, and better outcomes for patients. We really are entering a new era of healthcare, and we're excited about the possibilities ahead. And now I will turn it over to Carrie-Anne Fenn and Shane Hardy for some special award announcements. Carrie-Anne, over to you.
Thank you. Good evening, everyone. I'm honored to announce the recipients for the past 2 years for the Dr. George Blake Mentorship and Bursary Award. Dr. George Blake was a Black Jamaican Canadian who received his doctorate in clinical psychology from Edinburgh University. He served in the Royal Air Force during World War II. In 1967, Dr. Blake founded the original Pinewood Center, which today is known for its high-quality mental health and addiction services right here at Lakeridge Health. Today, there are 13 Pinewood Center locations across the Central East Lynn, in Scarborough, and throughout Durham region. The legacy of our Black community is an important part of our community, which is why it's imperative to not only recognize the challenging work and dedication of leaders like Dr. Blake, but to ensure that such legacy touches the next generation of mental health professionals from the Black community. Dr. Blake was a staunch supporter and advocate for higher education. In keeping with Dr. Blake's legacy of inspiring future generations of students and promoting an inclusive community, each year in partnership with Durham College, Lakeridge Health awards the Dr. George Blake Mentorship and Bursary to a mental health nursing student. Recipients of this legacy award receive a hands-on learning experience in mental health and addiction. The award is announced during Nursing Week in May of each year. I am pleased to announce Ariel Bobby as the recipient of this award in 2020, and Melissa Powell as the recipient of this award in 2021. Both Ariel and Melissa have a keen interest in mental health and recognizes its importance to one's overall health and well-being. This award will enable them to gain further understanding of the skills, nursing care, and intervention required to effectively care for patients impacted by mental illness. We want to thank Dr. Blake's family for sharing him with us, Dr. Leroy Clark for his efforts ensuring that we honor the legacy of Dr. Blake. A special thank you to our partner, Durham College. Congratulations to Ariel and Melissa. I will now turn over the AGM to Shane Hardy.
Good evening, everyone. It is my pleasure to announce the Local Healthcare Hero Awards. This award recognizes an individual or group who supports and promotes the healthcare needs of the community, embraces similarities, celebrates differences, and are willing to assist with care and compassion, and furthers the healthcare needs of the community where the AGM is being held. Last year, due to the pandemic, we paused giving this award. So this year, we're happy to announce 2 recipients for both fiscal year 2019-20 and 2020-2021. Because Bowmanville was the intended site with this year's AGM, the 2019-20 Local Healthcare Hero Award will be given to a member from the Clarington community. And it is my very great pleasure to announce the recipient of the 2019-20 Local Healthcare Hero Award, Chris Coy. Chris Coy is a lifelong resident of Bowmanville and has dedicated over 35 years to supporting healthcare needs in the community. She has held various professional positions within Bowmanville Hospital and Lakeridge Health and has helped raise funds for many important community projects. Chris is currently chair of the board of directors for the Bowmanville Health Hospital Foundation and has made significant contributions to the We Care, We Can campaign to support the expansion of the Bowmanville Hospital. She has also been a board member for Grandview Children's Center, Durham Christian Homes, and the Glen Hill Strathaven Task Force. These contributions speak volumes about Chris's deep devotion to the community she serves. And I will now hand it over to Chris to say a few words.
Thank you, Shane, for this wonderful award. I am very honored to have received it. But I always think that awards like this are part of a team award. And I would like to recognize the Bowmanville Foundation Board of Directors and staff and all the community partners and Lakeridge Health team that have worked tirelessly and dedicated so much time with me to make sure that we've been successful and the things that we've been trying to achieve for the expansion and renovation of the Bowmanville Hospital. We are all so focused on getting high quality healthcare and expanded healthcare to our community in Bowmanville and surrounding area. And I consider this award recognition of the efforts of many, many who have helped me along the way to make these achievements successful. So again, I am so honored and thank you very much of thinking of me when I know there are many, many people who would have been worthy for this achievement. Thanks so much.
From the entire Lakeridge Health community, thank you again, Chris. Now, for the 2020-21 Local Healthcare Hero Award. You have already heard Sharon, Cindy, and Tony speak of the exceptional contributions of the Lakeridge Health team, who came together quickly to respond to the needs of the community with courage, compassion, and resiliency. Despite the strain of the pandemic, healthcare workers continue to deliver high-quality care and ensure the safety of patients and families, whether in a hospital, a long-term care facility, or in the community. The Lakeridge Health team demonstrated great leadership and many remarkable achievements, providing support for hundreds of thousands of people who require services either in person or virtually. And for these reasons and many more, we are proud to announce the 2020-21 Local Healthcare Hero Award to the healthcare workers of Lakeridge Health. A heartfelt thank you to all of you for all that you do. And I will now ask Julie Goldstein, Clinical Director of the COVID-19 Response Team, to accept this award on behalf of the Lakeridge Health team. Julie?
Thanks very much, Shane. And I really am here on behalf of everyone on this team. And I just have a few remarks. When we think of heroes, I think the concept of courage that comes to mind. And I have a very small, brief passage from Ambrose Redmond, who speaks of courage. And really, it resonates for me in that in order to have courage, you have to have true bravery, and then live that bravery out. And Ambrose goes on to say, courage is not the absence of fear, but rather the judgment that something else is more important than one's fear. The timid presume it is lack of fear that allows the brave to act when the timid do not. But to take action when one is not afraid is easy. To refrain when afraid is also easy. But to take action regardless of fear is brave. Everyone at Lakeridge has been brave. Everyone has called on their inner courage to come, to make decisions, and to work hard on behalf of our residents and our entire community and one another. So it's with real humility that I thank the board and the AGM for this opportunity to accept this a very generous award on behalf of the absolute entire team here at Lakeridge Health. Thank you.
Thank you, Julie, and the entire team. I will now turn it back to our chair, Sharon Cochran.
Thank you, Shane. I was quite moved by both speeches, so I forgot to unmute myself. Now for the business portion of the meeting. Just a few quick items for the corporate members. One is all the documentation to support the voting has been posted on the Lakeridge Health website. To facilitate our virtual meeting, we have pre-selected members to move and to second the motions. As chair, I will open the voting for each motion. Corporate members can then vote by selecting whether they are for or against a motion. Corporate members will receive a confirmation of their vote, and we will be allowing about 30 seconds pause for each motion. And once the votes are tallied, we will announce the results. So with that, Cindy, as the secretary to the meeting, can you please confirm we have quorum?
In accordance with section 2.3 of the administrative bylaws, notice of the annual general meeting was given. We have 33 members and we have a quorum.
Thank you, Cindy. I now call the meeting to order, the 2021 virtual annual general meeting of Lakeridge Health. And again, please remember that corporate members will be prompted to vote on each motion. May I have a motion to approve the agenda?
Good evening. I move the motion to approve the agenda.
May I have a seconder?
Yes, I second the motion.
Thank you to Alok and Thelson. The motion to approve the agenda is now open for voting for about 30 seconds. The voting is now closed. And the motion to approve the agenda has been carried. We will now move into the next motion. The minutes from the last AGM are posted on the Lakeridge Health website. May I have a motion to approve the minutes of the annual general meeting held on June 18th, 2020?
I move the motion to accept the minutes.
May I have a seconder?
I second the motion.
Thank you, Shane and Cordelia. The motion to approve the minutes from the last AGM is now open. It's open for, again, for 30 seconds. The voting is now closed. And the motion to accept the minutes has been carried. Move on to the next agenda item. Now Cordelia Clark-Julian will highlight the proposed amendments to the administrative bylaws. Cordelia.
Thank you, Sharon. Good evening, everyone. The proposed administrative bylaw amendments were posted on our website for review. As recommended by the Board of Trustees, the members approve the administrative bylaw revisions, which include updates to reflect non-binary pronouns, include some language around hosting electronic meetings, and allow for annual meetings to be held between June and July 31st instead of just in the month of June. As this completes my update, I move to accept the amendments made to the administrative bylaws.
May I have a seconder?
I second the motion.
Thank you, Cordelia and Karen. The motion to accept the amendments to the administrative bylaws is now open for voting, again for 30 seconds. The voting is now closed. And the motion has been carried. I will now ask Alok Sethi to present the treasurer's report. Alok?
Thank you, Sharon. Good evening to all. And before I start, I just want to provide my sincere thank you to the staff of Lakeridge for their dedication to one of the most challenging health years ever. I am pleased to advise members that our auditors, PricewaterhouseCoopers, have provided an unqualified audit opinion with no material weaknesses in financial internal controls. For the year ended March 31st, 2021, Lakeridge Health achieved a surplus of $5.5 million. This includes the net effect of integration with Durham Mental Health Services of $2.2 million, and accounting entry to increase net assets at time of amalgamation. COVID-19 expenses and lost revenues resulting from the COVID-19 were significant, totaling over $88 million. The Ministry of Health introduced specific funding streams to reimburse direct COVID-19 expenses, fund lost revenue, and permitted the recognition of unearned revenues, for example, for quality-based procedures that were not performed, effectively addressing the financial operating impacts of the pandemic. In addition, Lakeridge Health received $9.5 million of COVID-19 related funding from the Ministries of Health and Long-Term Care to purchase capital equipment. Overall revenues were $770 million, with approximately 82% of our funding coming from the Ministry of Health. Overall expenditures were $767 million, with compensation and benefits continuing to be our most significant cost, accounting for approximately 65% of expenditures. Lakeridge Health also contributed $2.1 million to Thinking Fund in support of bond repayment for the clinical information system and in alignment with board established criteria. My report is completed. I move to accept the Treasury report for the year ending March 31st, 2021.
May I have a seconder?
I second the motion.
Thank you, Alok and Cordelia. The motion to accept the treasurer's report for the year ending March 31st, 2021 is now open for voting. Again, voting for 30 seconds. The voting is now closed. Thank you. And the motion has been carried. I now will ask Alok to introduce the proposed appointment of auditors.
Thank you, Sharon. I move that PricewaterhouseCoopers be appointed as auditors for the year ending March 31st, 2022, and that the Lakeridge Health Board of Trustees be authorized to set their remuneration.
May I have a seconder?
I second the motion.
Thank you, Alok and Felson. The motion to appoint PricewaterhouseCoopers as auditors for the year ending March 31st, 2022 is now open for voting for 30 seconds. The voting is now closed. Thank you. And the motion to appoint PricewaterhouseCoopers as auditors for the year ending March 31st, 2022 has been carried. I now ask Felson Desmore, Chair of the Nominations Committee, to present the number of elected board trustees for 21-22.
Sharon, as a matter of process, we need to table a motion to establish the number of elected board members to Board of Trustee members for 2021 and 2022. I move that the size of the Board of Trustees for 2021-2022 will be fixed at 18 elected / appointed trustees. So that would be 16 elected, 2 appointed.
May I have a seconder for the
I
motion?
second the motion.
Thank you, Thelson and Carrion. The motion to accept the size of the Board of Trustees for 21-22 as 18 trustees, 16 elected, 2 appointed is now open for voting for 30 seconds. The voting is now closed. Thank you. And the motion has been carried. I now will ask Thelson to present the nominations of elected Board of Trustees for 2021-22. Thelson.
Yes, thanks again, Sharon. It is now my pleasure to discuss the nominations to the Board of Trustees. The slate of nominees includes the following individuals: Tom McCullough of Pickering and Jade Maxwell Rodriguez of Brooklyn. On the recommendation of the Nominations Committee, the Board recommends their appointment to the Board of Trustees. So I move that Tom McCullough of Pickering and Jade Maxwell Rodriguez of Brooklyn be elected for a 3-year term.
May I have a seconder?
I second the motion.
Thank you, Thelson and Cordelia. This motion to accept the slate of nominations is now open for voting for 30 seconds. Voting is now closed. and the motion has been carried. And thank you and congratulations to our 2 new board members. Tonight, we would like to thank Judeline Innocent for her service as she transitions off the Lakeridge Health Board. Judeline has served Lakeridge Health and our communities for the past 3 years. She has been integral to our important work to ensure high quality care, and she has been the chair of the Quality Committee and has amplified the voice of the community in all we do. Just a huge thank you to Judeline. On behalf of the Board of Trustees, I thank all of you for your support and for your commitment to the health and the well-being of the Durham region. We are excited about continuing our work with all of you to better support the communities we serve well into the future. As this concludes the annual general meeting of Lakeridge Health for the fiscal year 2021, sorry, it's 2020-2021, I move to adjourn the meeting. May I have a seconder?
I second the motion.
Thank you, Shane. The motion to adjourn the meeting is now open for voting for 30 seconds. Voting is now closed. And I am sure this motion is carried. The motion has been carried. Thank you for everyone for attending tonight. And we wish you a safe and a happy summer. Good night.
Good night. Thank you.
Bye-bye.
Bye.